So guys, I have tried my very best to make sure I put this in layman terms. So if you have any questions about what I'm saying, please just ask. Chris is going to be taking a look on the Facebook Live just to make sure. So there's a new variant or this new strain from the UK that has been all over the news. And I got information. They did what they call a threat assessment brief from the version of the UK CDC, which is the European Center for Disease and Prevention and Control, okay? So this is where this information came from. So the first thing I want to do is show you a picture of the coronavirus itself. Now, the coronavirus is named the coronavirus because of these nice little red spikes that are coming off of this virus, and it reminded people of a crown, and that's why corona means crown. This is why the coronavirus is so interesting. It's kind of cool looking under the microscope, and because of these spikes, it kind of gives it a unique appearance and a unique look to it. Okay, so this UK variant, which is this new strain from the UK, over the past couple of weeks, they've had a rapid increase in the number of cases. And the increase was most pronounced in one major area of England, which is Southeast England. Now, this one is becoming the main strain, so the dominant variant in this area, causing over 60% of the infections in London this month, okay? And they give it the name. Our current COVID-19 is our like nickname for it, but it's the SARS-2 virus, and this is the name, SARS-2-CoV/2/01. And believe it or not, that is the abbreviated name. It's much longer than that. And the earliest cases that they found of this new strain was in September 2020. And can you see? Oh, they said I'm back. Perfect. It's moving. Okay. Okay. So let's go back. So these are the proteins. I want to make sure you guys saw these spiky protein. Okay. All right. Okay, perfect. Okay, so studies on the new virus, the new variant, or this new strain are ongoing, and no data suggests, nothing suggests that it makes you worse sick or makes you die faster, and no specific age group can they find right now. The median age, which means they put all the ages together, and the mid ages around people who have this new strain are 41 years old, but the age range is between 11 years old and 71 years old. Are you guys still hearing? Okay, good. So what I wanted to do is show you guys, when you have a mutation, what is a mutation? A mutation is something that changes the virus a little bit. Now, remember, they have those like little bit of red, spiky kind of proteins on there. There it is. There's a picture. Now, when you have a mutation, sometimes things change. So like you can have, instead of red, it could be green, a little different, a little change. And so they are talking about, they're showing like two different like variants, two different types of a mutation that can make that same virus that looks the same look a little bit different. So when we talk about mutations, something changes a little to make the virus look a little different. So let's talk about mutations. What we know about the mutations. Now, the new strain has nearly 24 mutations. That means difference looking on the spiky protein of the virus that causes it to infect the cells. The mutations they're saying seems to be higher than expected for just random mutations. So for some unknown reason, this has mutated a lot. And there's no evidence available on whether there are any, if this makes it more aggressive than the other one, except that it causes people to catch the infection faster. Okay, so we don't know right now how it impacts the vaccine that all of us are getting just yet. So we still have to watch this new variant to see what's going on. Okay. Now, one of the things we want you guys to know is that viruses constantly change through mutation. This is nothing new. New mutations are always expected, and different types of viruses have been found all across the globe of the COVID-19. So different types of strains, right? All across the globe. When a virus gets to different places, it mutates. So this is nothing new. But some mutations allow some viruses to be more infectious. And that's what they have found with this one. This new strain has the advantage of increasing the infectivity, allowing us to pass it from person to person. Now, what's scary about this new virus is that this is Christmas time. Okay, so we know viruses pass, and people like to get together, and they like to come together at this time all around the globe. And so, what we're trying to do is explain to people, this is why it's really important to try to stay with your own household this Christmas, because you can spread it very easily. Well, in the UK, they're telling their people, stay at home, try to keep it to one household, because this new strain is causing people to get infected more easily. So they talked about how did this strain come to be? What are possible sources of a new strain? Well, you can get a new strain from a prolonged infection in someone who has a weakened immune system. And when that happens, the virus can mutate pretty easily in this person and then spread. Or they can see changes in people when an animal has the viruses and give it back to a human being. Okay, so they can see changes in that, and that happened in Denmark. Okay, they had minks who got a virus, the COVID-19 virus. It mutated, went back to a human person. And then in some countries, they don't search, like in Europe and in the United States, they monitor the different strains around here, and they look at them very closely to make sure, is this strain more infectious? Is this strain versus that strain? Well, in some countries, they don't have the scientists there to do that, to monitor different strains. And so, unfortunately, new mutations could be developing and no one knows, and then it spreads to different parts of the world. This new the new strain, it spreads more easily because of those changes in those spikes in the protein, and they estimate that it increases the ability to transmit the disease up to 70% more than the normal COVID-19. And we need further studies to look at how it's doing it and why it's doing it. And then they have found parts of this new strain in other places outside of the UK, which is in Belgium, Denmark, and the Netherlands. So for them, they pretty much feel like this new strain will get a chance to go to other parts of the world. We think that our PCR test that we have in the United States will detect this version of the virus. And at this moment, our US experts are saying that there is no reason to believe that the vaccines that are currently developed will not be effective against this virus. Vaccines produce wide range of responses by the immune system beyond those of the spike protein. So they're saying that they feel that our vaccine should work, and the possibility that new strains will be resistant to existing vaccines are low, but not so they're saying it's low, but not impossible for them not to, respond to the vaccine, but it's low. So they think that our vaccine should be able to cover the new strain that's out in the UK, just in case it gets here in the United States. But more investigations are on the way. And the UK government and the scientists are watching for failures of the Pfizer vaccine. They got the Pfizer vaccine before the United States did, and they're watching for failures against the new strain. So they're watching very closely to let us know if they find that there are any failures. At this time, our experts in the United States said there's no reason to believe that our vaccine should not work against this strain. And there were just yesterday, hot off the press, newspaper clippings saying that Pfizer and Moderna are testing their vaccines against this new variant of the virus. So just know that. So probably by the time the general public gets the vaccine, they'll have more information about whether or not the vaccine actually responds to this new strain of the virus. What the UK did was they said they put stricter measures on all their people. Like they said, stay home, and then they had bans on travel. And other countries said people from the UK can't come to their country because of this new strain. So we want people to know they're saying stay home, don't fly from different places because they really don't want to spread this to other locations. And finally, some of our experts, Dr. Murphy, he's the new Surgeon General nominee from President-elect Joe Biden. This is what he said for us people here in the United States. The new strain doesn't change the public health advice on the 3 Ws. He didn't say the 3 Ws, I said the 3 Ws, but he said on wearing your mask, washing your hands, and maintaining social distance. So that goes to tell us that even though we're all starting to slowly but surely trickle out with this vaccine, it still doesn't do this, it still doesn't take away those simple things that we want you to do to help protect yourself. The 3 Ws, wear your mask, wash your hands, watch your distance. That still will be, whether there's a new strain or not, that will help protect you so that you wouldn't pass COVID-19 or any strain of it to anyone else. That's the end, guys. Any questions? Okay, great.
So just as a takeaway, so obviously we'll watch and see the data. There is a page on CDC's website as well that you can go to that looks at the new strain information. A lot of the information is what Dr. Pruitt covered today, knowing that they are obviously continuing to look and study at any variations that will come up, and something that honestly we expect to see at some point in time, and that the CDC does do genome sequencing. So the process for when you get a swab, you would never know if your swab was eventually sent in to the CDC to be tested. But once the swab is at the lab, it's typically those that go to the state laboratory, not so much those maybe that from private labs like Quest and such. But because our state laboratory is part of the laboratory response network at CDC, a portion of those samples from all the states get sent. And then what they do is that sequencing level at the CDC. So they continue to look for those variations amongst the virus, and then continue to study those variations amongst the virus. So I think it does bring a level of anxiety a little bit when people are saying like, okay, is the vaccine not going to work? Is it going to be more deadly? You know, all of those things that we'll continue to watch for. But knowing right now that PCR tests most likely should work, the vaccine should likely still be able to protect us. And then obviously prevention strategies will continue to work, as we know, to prevent not only the spread of COVID or any variations of COVID, but a lot of other diseases as well, like influenza and others. So do we have, we're pretty much right on time today, which is great. Any other last tidbits of information to cover? I don't see, you're welcome. Thank you guys for watching today. Some thank yous in there. Don't see any other questions.
No, we just want to say Merry Christmas to you guys. Have a safe and happy Christmas time. And we'll see you next week, and we'll give details about the Moderna virus. I mean, the Moderna vaccine, not the virus. Moderna's vaccine next week. Merry Christmas.
Yeah. Merry Christmas, everyone. Happy New Year, and take care.
Bye-bye.